From there, let's cross over to the Ashanti region, where the Director of Health, Dr. Emmanuel Tinkrang, has been engaging and talking about the rollout of COVID-19 vaccines in the region.
Today, some of the children who survived that accident play in the leftover rubble.
The recovery is 19,468. Unfortunately, we've lost 361 persons due to COVID in Ashanti region. Our total active cases as at now stands at 361. We have 18 persons on admission. 8 are very severe, 2 are moderate, and 1 is critical. So if you look at the last update, you realize that we are now getting to the tail end of our third wave. But we need to continue with what we're already doing by adhering to the protocols and then ensure that the vaccination program that we've started in Ashanti continued. We have been given a total of 70,300 doses of AstraZeneca, and we are going to start immunization of all those who couldn't get the opportunity to have their second dose. Those who had their first dose for AstraZeneca in Ashanti region were close to 100,000. But as at now, we've received a total of 70,500 doses of AstraZeneca. We are encouraging all those who couldn't get their second dose to patronize this one, because it's very important. And this vaccination is meant for those who have already taken their first dose AstraZeneca and are waiting for their second dose. So if you've taken Johnson & Johnson, or you've taken Sputnik, or you've completed your dose for AstraZeneca, or you've not been vaccinated at all, this one is not for you. This particular vaccination is meant for those who are waiting for their second dose AstraZeneca. And as I said, we will give it to all health workers and then the general public who has been given their first dose AstraZeneca. It's very, very important we do that. The program is starting on the 1st of September, and we will take 5 days to finish. So we are encouraging everyone to take part. If you've taken your first dose, it's very, very important you take your second dose and complete. A number of people have been complaining that their second dose have delayed. And this is the time. The government has done so well to get us this vaccine. So let us take advantage and ensure that we are fully vaccinated for AstraZeneca. So when you get your second dose, that means that you've completed the dose for AstraZeneca. And as I said, we have a backlog, close to 100,000 people to be vaccinated. But we have limited quantity of vaccines, that's 70,000. The 30,000 will come later. But we are encouraging you to make sure that you patronize so as to complete all the 70,000 that we've been given in Ashanti region. So far, we've done very well to contain the third wave. We are almost getting to the tail end, and I believe that when we adhere to the protocols and then follow all the instructions that has been prescribed, and then take part in the vaccination, we are very certain that we will conquer COVID-19. On that note, we will do a short presentation for you to see how we are progressing in the region. So let me take the tree and then so this is the Ashanti Region COVID-19 situation update as at week 34. So this is the summary. The new cases we've recorded from 2nd July to 27th August is 327. Total cumulative cases in Ashanti Region stands at 20,170. Discharge and recovery is 19,464. We've lost 361 persons to COVID-19 in the region. And as at now, our active cases is 341.